Hi, this is Jay Gosuico with EMT Paramedics on Facebook, and my friend Rod Savage at rodsavage.com. Feel free to share this information if you find it useful with your medic and corpsman friends, and let's just jump in. This is AAA versus dissection. A lot of you have heard about what a AAA is. It sounds pretty cool, I guess, but I'll explain why a AAA always happens in the abdomen, and except for a severe traumatic event or a congenital defect, a dissection always happens in the upper part of your aorta, your ascending aorta. So a couple of finer points on anatomy and physiology. Your aorta comes in four different spots: your ascending aorta, your aortic arch, where your right and left blood pressures arms get their blood supply from, and then your thoracic aorta and your abdominal aorta. So a dissection always happens in the beginning part of the aortic arch. That's a dissection. And your AAA, your abdominal aneurysm, always happens down here in your abdomen. So down here is a AAA, or abdominal aortic aneurysm, right? And up here is dissection. So if this was a poorly designed aorta and I left it out in the backyard for a long, long time, got really hard and stenotic, it didn't bounce back very well, what would happen is with hypertension, right, with high blood pressure, the heart's pumping up into this arch, into this circular kind of arch, and the heart's pumping in this direction, and what happens is a little hangnail forms on the inside of the aorta, and that blood pressure continues over a course period of years, right, sometimes decades. This blood pressure kind of erodes the inside of that aorta, the ascending aorta, and that erosion gets bigger and bigger, and it turns into a small little windsock, a divider. So when it turns into a divider, that's officially what a dissection is, right? So as it turns into a divider or a windsock, it collects all the blood pressure, and all your blood pressure from your heart pumps up into the dissection, and a little bit of blood pressure trickles downstream on the other side. So why is that important? Because in the medic, if you have time and they have a history of hypertension or other cardiac history, if you have time, you can take a blood pressure on the right side and on the left side. And one of the classic symptoms of an aortic dissection is that your blood pressure on the right side is greater than on the left side, right? So your right side is greater than the left side. The reason for that is your heart is pumping blood pressure up into that dissection, and it's going towards the right side, your right arm, creating a higher blood pressure in your right arm. The left arm blood supply is on the other side of the divider, the other side of the dissection. So your left arm blood pressure gets a much lower blood pressure from that trickling around the dissection effect. Okay, so what are these blood pressures? Well, I already said they have hypertension, so I'm going to expect a blood pressure above 150 and probably a diastolic above 90. So if I have a systolic above 150 and a diastolic above 90, on the left side, what I'll get is probably a systolic in the 110s range, right? Or it could be 110, it could be up to like 130, but it'll be a significant difference between the right arm than the left arm. Some of those numbers won't correlate, but it'll be a significant lower. The diastolic's going to be about the same. The diastolic that's coming out is the heart at rest. So the diastolic is going to be the same. Very critical, because sometimes that diastolic is so high, right? If I start getting into the 120 range, right, that diastolic is super high. I'm afraid that the pulsatile mass on my AAA, my abdominal aortic aneurysm, my pulsatile mass that's consistent with AAA will blow with that big high blood pressure, only giving me seconds to get into this person into the hospital. So really important that you know where the hypertensive crisis starts in when this lower blood pressure, your diastolic, gets into the above the 90s, 100s, 110s. Get them to the hospital, especially if you suspect a pulsatile or you find a pulsatile mass in the abdomen, right? So treated differently in the hospital. If they have chest pain, then follow your protocols for chest pain. But basically, because of the hypertensive issue, if they have high blood pressure, you're going to want to lower the blood pressure of a dissection. That's going to be more important. And en route, you might be able to use nitroglycerin, but follow your brace protocols, all right? And that's what's going to happen when they get to the hospital. We'll probably even use even stronger vasoactive medicines to decrease that blood pressure. You don't want to drop it too quickly, but you do want to drop it from the hypertensive crisis range. And then that's what we're going to do for a dissection. For a aneurysm, we're going to prep them to go to the OR. So we're going to do this a little differently. The blood pressure is going to be important, yes, but I'm going to want two large bore IVs because I want to be able to resuscitate this guy with fluids and with blood products. All right. So, and the only way to save this life, a lot of times this is just leaking. The aneurysm is just leaking. So I'll just be able to give fluids and blood products to it. If this blows, then I'm definitely in CPR resus mode. So I'm going to want my two IVs in place to give him meds and for fluid resuscitation. Okay, so hopefully now I've explained why it's important to get a right and left blood pressure if you have time with someone with a cardiac distress, and what the information is conveying over the radio when you do call it out, and that you now understand what AAA versus dissection is. All right, this is go find my friends at EMT Paramedics on Facebook, and again my friend Roz Savage, who is a solo ocean rower and an environmental campaigner, and help me and help her out with an environmental campaign and a message to the rest of the world. All right, so take care, Shaka and Mahalo, and I will see you on the next go around at EMT Paramedics on Facebook.